Hi, QuickTake. Welcome to our live Q&A on the post-lockdown world. I'm Kurumi Mori in Tokyo. As the number of COVID-19 cases appear to level out in some parts of the world, lockdowns have started to ease, but questions do remain about what the so-called new normal will really look like day to day. So to answer that and more, let me now introduce you to our guests. We have brothers Stefan Hajkowicz, Senior Principal Scientist, Strategy and Foresight, and Director of CSIRO Data61 Insights, and Krispin Hajkowicz, Director of the Infectious Diseases Unit at Australia's largest hospital and Senior Lecturer at the University of Queensland, both joining us from Brisbane. And of course, Bloomberg News Health Editor Jason Gale from Melbourne. So nice to have you all. And we have siblings today. Welcome. Thanks for joining us. So Stefan and Krispin, who's the older brother?
Can you guess?
Jason, what do you think?
I think it's Stefan.
Oh, wait, I can't.
I'm the older one. Don't ask us who the tallest one is.
So you're both in sciences with a career in science. How did childhood have anything to do with that?
Might help. Our dad was a physicist, so upper atmosphere physics he did. So that probably rubbed off on us a bit.
Yeah. I'm the only member of the family who doesn't have a PhD. I'm a medical doctor, so.
Is there some sibling rivalry here?
Look, I'm so far ahead, it's not really rivalry. We just,
It's not rivalry. You've already won.
Yeah. Well, a little bit of rivalry. Yeah. Lucky you got us on a video link.
Is it just you two brothers, or do you have other siblings?
Elder brother. We got an elder brother too.
Oh, we should have invited him on.
Yeah.
Next time.
Sure.
Okay, well, we're really happy to have you both on. And for everybody watching us, please ask us your questions live, and I'll do my best to get them answered throughout this broadcast. So something I want to touch on before we get started, though, is something we can't ignore right now are the U.S. protests going on. How does that relate to the spread of COVID-19? Is that something that you two have been watching and have any concerns about with the mass protests happening across the country?
Well, Remy, I wouldn't comment on the protest directly, but obviously any situation where large numbers of people gather together, where they can't maintain social distancing of 1.5 metres, and when there's prolonged close contact is going to lead to transmission of COVID-19.
Right, yeah. I mean, everybody seems to be very close together. But, it may be something that is a concern going forward. We've seen Hong Kong protests going on for so long before the pandemic started. Clearly people with masks, but they're still very in close quarters. So I guess the situation now is evolving with COVID-19. What do we know about the virus now, and how long do you think it will stick around for, Krispin, if you could touch on that?
It's here to stay for a long time, unfortunately. Although in parts of the world now, 20 to 30% of the population may have been infected with COVID-19. That still means there's 70% of the population is uninfected and non-immune. In Australia, only 0.03% of the population has been infected. So there's an extremely large pool of immune-naive people who can still be infected. And if you think of a virus spreading through the world like a fire, the fire needs fuel to burn, and the fuel here is people who are not immune to COVID-19, and there are still billions of people in the world that are not immune to COVID-19. So unfortunately, it's going to be here for a long time.
And Stefan, how will that affect? Oh, go ahead, Jason.
I was going to say, Stefan, what do you think that will mean for the way in which we need to kind of adapt to this new virus and its various sort of interesting characteristics that demand things like physical distancing to prevent transmission?
The impact of this is just unprecedented. I've put together a whole series of graphs on the shock to the global economy, and each one you would say, we've never seen it. This is unprecedented, more than ever before. The OECD is estimating 2% is knocked off global GDP growth. Global trade is forecast to fall by 27% in the next quarter. In Australia, the Treasury has forecast a fall of over 10% in the June quarter. Statistic after statistic is showing us this massive shock in terms of unemployment, and economic impact more than we've ever seen. So we're at the beginning of a journey here. This is a marathon, not a sprint. The infectious disease period will translate into an economic crisis and already is. And there's a massive challenge for the world to dig itself out of this position. We've got to remember the world's economies, the world's advanced economies are going into this situation with record debt levels, record debt to GDP levels and record low interest rates. So it's hard to do a fix, but we're in for a massive amount of effort to take the world from where it is today to a healthy economy. And that's the next part of this journey is we've started to sort of see the epidemiology go towards the field of economics, and I think the two are needed hand in hand for a while. We need to understand the economic consequences of health decisions and vice versa to try and get the interplay right and give people the best chance of getting a job. But the masses of unemployment, like the US data I'm looking at, shows a jump from 6.2% unemployment to 14.7% in the month of April, which is a shocking outcome for millions of Americans who are now, for the first time, registering for unemployment benefits.
Yeah, I think we've been seeing... Oh, go ahead, Jason.
Krispin, it feels like we've continued to learn so much about the virus over the last 5 months. The way it spreads, the way we see so many people who are asymptomatically infected. Do you think there's much more we still have to learn about this virus, or do you think we've pretty much found out all there is to know?
Oh, look, there's an extraordinary amount of publishing data emerging in the literature now. But if you look at HIV as a comparison, we're really at sort of 1981 or 1984 for HIV. We're just at the absolute beginning of understanding this virus. There's huge amounts still to know. I mean, it's exciting and interesting. It's also worrying how little we still really understand about the virus. The number of publications cited with COVID in the title is something hitting several thousand a week at the moment. And there's a bit of chaff in there, but there's a lot of incredible information coming out about transmission, about infectivity, about treatments, about vaccines, and every bit of knowledge is a step in the right direction. You have darkness and fear, and the treatment for that is knowledge and understanding of the virus. And I personally have learned so much about this virus in the last few months when it obviously wasn't on our radar in December 2019.
So, Krispin, let's extend our earlier conversation. And I wanted to know from you, when's the next COVID-19 happening? Because we're working with businesses, small businesses, to large corporations that are massively changing operations right now for the COVID period. Are they just fixing things for COVID-19, or is there a COVID 2025, a COVID 2030? Tell us about the future.
I mean, unfortunately, yes, there will be further pandemics. And in history, we've had a severe, major, fairly disastrous pandemic every 50 years on average for at least the last 500 years. And we've had smaller pandemics every 5 to 10 years. So roughly 5 years ago, we had the Ebola pandemic in West Africa. In 2009, we had the H1N1 swine flu pandemic. It's absolutely a question of when, not if. I guess that moving forward, the thing we really have to focus on is this idea of disease X. We don't know which disease it's going to be. And I think SARS-2 coronavirus has really shown us how important it is to prepare for the unknown. I think we're probably pretty well positioned for an influenza pandemic, and we had drug treatments and vaccines, but the vulnerability is another disease X, and whether it'll be another coronavirus or a totally different respiratory virus or possibly another infection, I don't know. And that's where the focus needs to move in the future. We need to have obviously a huge amount of understanding for this outbreak, but then we need to maintain what I think is beginning to be called the sort of the warm base. The warm base means you've got candidate vaccines ready to go, that it's not going to take 2 or 3 years to get them out. It's going to take 3 to 4 months to get them out. You've got a whole lot of broad spectrum antivirals that are going to work against a lot of different viruses straight up. With 25 new antivirals by 2025 was another theme I heard, that we're all ready to go, that next time this definitely happens, we can jump in and really be there in the first month or two of the pandemic and ready to go. And
business models that are resilient to these shocks in the future. So the university sector in Australia is well known to be taking a massive hit as overseas students are unable to arrive and the tuition fees aren't flowing anymore. But they're not just fixing things, I think, for COVID-19. I think, based on the sort of advice we're getting from health experts, This is a new future we're moving into. As businesses redesign the business model, they should be asking the question, how is this resilient to a future that looks like this? This can't be sort of like COVID-19 itself is going to go on for quite a while, but then there's future similar shocks. The other thing, Krispin, you were saying earlier to me was about the flu. No one's catching the flu anymore.
Yeah, I mean, that is extraordinary. But Kurumi and Jason, really, alongside the social distancing and border closures and so forth, have had a massive impact in Australia on preventing transmission of COVID. But in fact, influenza has largely disappeared as well. We have almost 0 cases of influenza a week, whereas we'd normally just be going into our peak season now. The childhood infection pertussis, the vaccine-preventable disease pertussis, normally would be around 1,800 cases a year. In Australia, there have been fewer than 200 so far, and there's been a massive impact on the social distancing of that. And it's very likely that a variety of other respiratory infections will not disappear, but become way less prominent as a result of the social distancing that's occurred for COVID. And that really makes me think that this does need to be the new normal, that a form of social distancing, infection control, attention to hygiene, attention to hand hygiene, social etiquette around coughing and tissues, and forms of social distancing is going to be the norm. It's going to be absolutely what we do. Kurumi, I was just thinking, really, some of the Asian nations that were more affected by SARS have coped much better, I think, and have been much more prepared for this, because I think there was a change in the social norms around social
the cultural norm,
yeah, the mask use and the etiquette and behaviour really was formed in Hong Kong and South Korea last time around 17 years ago. So I suspect you're probably feeling less of a change in cultural behaviour in Tokyo, certainly, than this time around.
Yeah, absolutely. I think it definitely has an impact. The history of SARS being in Asia, we talk a lot about the mask culture wars with, I grew up in the US where masks are not the norm, were not the norm before COVID-19. So this idea that, maybe Asia had a better handle of it before, we're more comfortable with it. Social distance culturally may have had an impact, absolutely. I mean, we're now seeing footage, though, of beaches and restaurants and gyms living this new normal, as you just mentioned, Krispin, and talking about how, post COVID-19, or at least coming out of lockdown, many places are adapting to new rules about how to stay further apart on the beaches, like this footage in Italian Riviera beaches. They deny access to people if the beach is fully booked. So maybe you go and you can't actually even enjoy the beach. There are restaurants with bars that have those the floaties that you have to be on, so that they make sure that you are further away from the other guests. This is a restaurant in France where you're in these wine glasses. This is a very creative way to social distance with your dining partner or your date. So, Krispin, I know you said that there will be a new normal. Stefan, in your opinion, is this something that will go on for a long time? Is this the new normal that will persist? Or is this just temporary until we find a vaccine? What's your take on this?
No, I think really the business as usual is over. I think it is towards a new normal in many ways. I mean, the extent of the economic shock is just massive, right? We've never seen anything like this. As an analyst, I could not have predicted any of these results last year or seen them as possible. I think the evidence is we're moving into a different sort of economy that's going to operate and be different, but then the need for ongoing infectious disease mitigation. City planners of big cities like Tokyo or Brisbane, Sydney need to be thinking, how do we make this city work to mitigate infectious disease risk, and much more profoundly than we ever have before. But also economic resilience. So another fantastic thing about Japan, Kurumi, that we mentioned briefly on the last interview was the unemployment rate, which I checked on the OECD, and they have something called the harmonized rate of unemployment, which is consistent across all OECD countries. And Japan comes in at 2.5% unemployment compared to the US, which is now around about that 14% mark, and the OECD average at 6%. So I think, as Krispin's saying, that some of these Asian countries with experience of SARS and H1N1, the previous infectious disease outbreaks, they've actually been able to adjust economically more efficiently to this. And I think that's the future we're moving towards. If you are in a large corporation and you're a head strategic planner, all of a sudden infectious disease risk is there in terms of how you structure your organization's activity, from supply chains changing through to how your workforce is managed, your ability to telework. The other big shift that we're picking up massively is the growth of the digital economy sector. The United Nations estimates 1.2 billion students across the world are studying online at some point, or studying remotely. Many of them are online. Teleworking is spiraling. Telehealth is off the charts. Online entertainment, online retail, all these aspects of the economy. And our digital tech sector companies are going counter trend. They're growing really fast. And on the ASX, I haven't studied other world markets, but the ASX is showing a really strong rebound for digital tech sector companies, whereas the general market is moving up gradually, but the digital tech sector is going about 3 times faster. So it's like, I think technology is playing a role in the restructure here.
Krispin, you're an infectious diseases doctor. You would have seen many of the same reports that I've seen, predicting this sort of pandemic. Does it surprise you of just how badly prepared we were for what we knew would be, something that was in our future?
It's amazing how severe this pandemic has been. It's extraordinary. It's unprecedented. Really, there's nothing like it until you go back to 1918 and look at the catastrophic Spanish flu pandemic. Really, yeah. I mean, if any of us online here had been asked that we'd be locked down, that the borders in Australia would be shut, that you couldn't take an international holiday, you'd think you'd be ridiculous. But of course, this has been predicted. We had a trial run with SARS-1, which was really a near miss in retrospect. Like, we had a really good trial run, and we learned a lot from that, and obviously the Australian response has been strong and based on a lot of the learnings from SARS, but it in retrospect does seem to be a fairly big lost opportunity in terms of things like vaccine development and drug treatment and so forth. As I'm sure you're aware, SARS-1 and SARS-2 coronavirus, the current one, are genetically quite similar. There's really not much difference, and a lot of the technology innovation that could have been put in place there would be really, really helpful right now. May have brought us a precious few extra months potentially in terms of vaccines, drug therapy, lessons about social distancing, infection control in hospitals, personal protective use equipment, stockpiling and that sort of thing. So, I think pandemics are absolutely the norm, and they're not going anywhere. And I guess the thing is now to make sure that this never happens again moving forward.
One of the things I took from the Spanish flu, actually, 1918-19 Spanish flu, was followed by the 1920-21 depression, where unemployment spiraled, the Dow Jones crashed. It was an economic depression worldwide, sometimes called the forgotten depression because people focus on the 30s. But what was interesting, in 1922 to 1929, we had what's called the Roaring Twenties, where economic growth really picked up. In fact, GDP growth rates were roughly double what they are compared to long-term averages over that period. And it took us right up to the 1930s, where speculation on Wall Street led to another bubble and crash. But during that decade there of the 1920s, the Roaring Twenties, things went really well. And I think, that in my work, I've been interested about what pathways we follow out of here and why. Some researchers from University of Adelaide and Columbia University in New York, macroeconomists, have said that the main thing that happened was electricity as a general purpose technology was widely deployed throughout that. So the shock to the system, which was Spanish flu, then economic shock, created space for technological innovation, which at the time was electricity, which led to productivity uplift and a whole lot of positive outcomes. So part of me is hopeful towards a positive future of the economic rebound from this situation. We see general purpose technologies like artificial intelligence, genetics, digital technologies more broadly. We can kind of see evidence of their uptake and use. And I think given the record debt levels we got, the low interest rates, governments don't have much room to move on fiscal stimulus or monetary policy. They may turn towards productivity uplift and technology enablement. Could be our way through. And that technology enablement is also what helps us mitigate infectious disease risk. Yeah,
Stefan, I would agree that really the solutions to making sure this never happens again are primarily innovative biotechnology. That's what's going to save the day. I'm talking vaccines, drug therapy, better diagnostics, and really novel ways of surveilling for infectious diseases. So this great idea of analysing a city's entire sewage samples for viruses to pick outbreaks in the sewage before we even detect human cases. Or another idea is to sample the bilge tanks of airlines and see if we can detect viruses in the bilge tanks, and you're going to get much quicker intelligence about the outbreak next time. I'm sure you've seen all the modelling that shows that really for every week that you respond to a pandemic with exponential growth potential, you save thousands and thousands of cases, really. So rapid response is just critical. Technology, biotechnology is what will get us there.
Absolutely.
Do you think that our personal information has to be, we have to have a different view on what is sort of private and what is confidential? If our fecal material is going to be sampled on an aeroplane, do we have to sort of expect that going forward, we're going to have to, for our own health security, be much more amenable to people knowing more about us?
Look, I work in the area of data and digital, and I think privacy is something that needs more attention. A lot of innovations that are really beneficial to us are held back due to privacy concerns. Now, some of that is very legitimate. You've got to be careful with people's privacy. People can be really harmed through a breach of their privacy. But at the same time, there's a lot of stuff that doesn't risk your privacy that is really beneficial to you. And I think infectious disease control, yes, being able to track and monitor and know where people are can really help. If, and with the strong proviso, if we're absolutely sure that information, that private information about your location and behavioural patterns is kept private and secure. And I think it can be. Again, science and technology solutions are needed to do this. As we move into the world of artificial intelligence, the ability to breach your privacy is greater than ever before. And there's a lot of bad players out there who are attempting to do it on a regular basis. But there's also some sort of, bizarre stuff around privacy, people being hyper, ultra sensitive to it, when the risks aren't that great. So as we looked at artificial intelligence in healthcare, we found a lot of life-saving interventions weren't going ahead because of privacy concerns and uncertainty by healthcare professionals about what was okay and wasn't around data privacy. So I don't know, Krispin, is data privacy...
I'd jump in and say that in general, people with infectious diseases have a very strong need for privacy. We've learned that again the hard way from HIV, but the moment you start breaching people's privacy, the moment you make testing compulsory rather than voluntary, the wheels fall off. You need people to be honest and frank, and you need to incentivize testing. If you breach people's privacy, if you force people to have tests, and if you discriminate against people because of their infectious diseases status, HIV being a really strong point in this, you worsen the epidemic, more people get infected and more people die. So in terms of those sort of mass sampling, I wouldn't be suggesting that they wouldn't identify who was sitting on the toilet in the plane. It'd be everyone on the plane. But it's probably the other way. You want people to be tested as much as possible, and privacy is the most important part of that. Now, most people are pretty happy to share their information to help society. It's only a minority that are worried about sharing information. But I guess the things they worry about is having their pathology results splashed all over the media or identified as part of an outbreak and then being hounded. And that's the worst thing you can do to reduce testing and drive people underground.
Right, definitely a tricky balance there. So just as a reminder for everybody joining us now on this broadcast, please ask us your questions live, and I'll do my best to get you the answers from our experts today throughout the broadcast, okay? Now I want to go on to touch on something that affects many of us. It's working from home. I think with the quarantine, it's affected so many of us all over the world. A few months ago, my team in Hong Kong actually showed us their work from home situation. So let's see this video that we put together. Here's what it's been like for them.
Oh my God, listen to that. Yeah, I need yoga today.
I prefer to be in the office mostly.
So working from home has some unique challenges.
It's just me and my couch and my laptop. So we're looking like this, working, and then it's hard on my neck. I'm always looking down.
I miss just that human interaction with my colleagues. I find that really important.
as I'm sitting here trying to edit a video, Millie will be bringing me a toy, or she'll be like rolling in front of me, purring. In a way, that's one of the best things of working from home, is I get to spend a lot of time with them, but I'm a little bit distracted.
I pretty much can work anywhere. As long as I have my laptop, I have Wi-Fi or data, I can be sitting at a cafe here in Sydney or anywhere else in the world, so that's a great thing.
I can just roll out of bed and start working. I don't have to change out of my pajamas. Yeah, I'm always in pajamas every day. I am always wearing a face mask. I have plants. I've been tending to my plants. I have a lot of avocado plants.
It's hard being a plant mom, you know?
I get to hang out with my dog, Bowie. This is Bowie, our little edit helper.
Yoga and meditation for me have been absolutely key to staying sane. Making lots of green smoothies. Cheers.
Cooking a lot. I'm also going to the gym a lot more.
And I'm doing super exciting things now. I am going to search for some blue paper because I'm down to 2 rolls in my house. And yet still no blue paper.
Yeah, so we see some pros and cons there of working from home. Stefan, we've talked about this briefly before, but let's talk about how the pandemic has changed the way we work and maybe preferences for where we live. Is this something that we will see persist? Is work from home going to be a new option for many companies, for many workers around the world?
Well, in Australia, prior to COVID-19, around 30% of all employed persons regularly work from their home in their main job or business. And it was definitely on an upward trajectory. Where we're at now, I'd say the vast majority. I've actually been searching for a reliable statistic on this. I can't find it, but practically everyone I know and in my team are all working from home. Are we going to go back again? Very few of the people I work with have yet done it. There are some benefits being reported as well as the sort of downsides of doing it, but one of which is commute times. The average commute time for a Brisbane resident to work is 60 minutes one way. It's probably a bit over that in Sydney, closer to 1.5 hours, I think, in Sydney's average commute time now. So people are getting quite a lot of time back in their day, and that's one aspect of the shift. But ultimately, I think those workforces in companies where people could easily switch to work from home, again, they were mostly tech sector companies that did it early, quickly and smoothly because of the nature of work, did a lot better. And it's an important, picking up on the concepts of economic resilience to future disease risk, the ability to shift work into a telework environment is a key aspect. The fact that I can keep earning money during this by teleworking is really important. So I think it's going to expand, and I don't think we're going back to normal. I think there will be a bit of a return to office, but a lot of people will stay working from home. Maybe we start to see some changes in real estate too. Maybe people start looking for those tree change options. There's a little bit of evidence, too early to say, but a little bit of evidence that may be occurring as well.
Chris, I'm curious for you. I mean, clearly as a physician, working from home full-time isn't really an option. How is the pandemic going to change the way people like you work?
We essentially can't really work from home, but our patients are voting with their feet and staying at home and using telemedicine to attend their clinic appointments. I was just thinking, I haven't actually seen a face-to-face outpatient for the last 2 weeks because it's all been video conference. Patients actually really prefer it. They don't have to pay for parking at the hospital. They don't want to come and get exposed to infectious diseases just for a routine medical visit. And I think healthcare is going to be dramatically transformed by this, and really embracing video conferencing, telemedicine. It'll mean huge access back gains for people in rural and remote locations who can't access city specialists. That's going to change forever. I have no desire to go back to the old days of a full waiting room with people copying all each other, driving for an hour to get here. And there are only benefits I really see. There are obviously exceptions when you need to examine a patient and perform a procedure, but that's the minority of work, I think, these days. And I think telemedicine is really going to take over.
My work from home day now means a mountain bike ride with my son in the morning up Mount Cootha because I've got time. I don't have to rush to work. and then another ride in the evening with my daughter to down the bikeway to a place called Rocks Riverside. And it's been fantastic. The main risk to my health is the open access fridge. Unlike the cafe, I don't have to pay any money for it. I think I might need to put a swipe credit card on it or something. But there's a lot of benefits to me, and I think
some of the unintended benefits of telemedicine is that you're in the patient's home. They can go to the drug cupboard and show you the medications they're on, and then you can look at the staircase that they might fall down, and then their husband or wife jumps in and gives you an update on how they think they're going. And it's a much more real interaction than the people coming into the hospital, and it's much more valuable.
I think it's a useful kick along for telehealth in that it's been there in health. I mean, you'll know more, Chris, but it's been there in health for quite a while, but it hasn't been really significant uptake until now. I'm looking at a data set of Medicare items claimed on telehealth, and it just shoots up in actually February, then to March and April. And I think this is actually going to be pretty critical for the world to deal with unsustainable healthcare expenditure growth. So in Australia, as per a lot of the OECD, healthcare expenditure is just growing way faster than GDP. We can't afford the bills today, let alone the future. And I think telehealth is an important part of the solution that brings those costs down while delivering the same quality of service. But yeah, Krispin, that's interesting to hear how you can
make it work. The other component of it is that we've learned in the last few months that there's obviously a lot of very low value care that we deliver in healthcare that just can stop altogether. You just don't need to do it anymore. People are voting with their feet to not engage in things that actually aren't very useful, and we just don't have to go back to doing them again. It'll save a lot of money.
Do you think it would be able to see any discernible difference in things like hospital healthcare associated infections with keeping fewer people out?
The less you move people around, the less chance they have to spread infections like antibiotic-resistant infections and so forth. I don't know if you've seen, Jason, in the media really reports of decreased antibiotic use by 50 to 50% in the States, for example. There's just been a dramatic decrease in unnecessary antibiotic prescriptions, something I'm very interested and worried about, and that's going to have huge beneficial flow-on effects. The other thing we're seeing, I guess, is better connections with community pharmacy and community general practitioners now, much better linkages with primary care. A whole lot of conditions that maybe were seen to be specialist medicine previously, like hepatitis C treatment, that can actually be done really well in primary care by GPs just with a phone call or a video link to a specialist as required. And again, I just can't emphasise enough how important that is for rural and remote people who really are accessing some healthcare for the first time. So patients in the far rural areas of Queensland can now do a stress test for a cardiac condition monitored on a video camera from Brisbane with all of the tests and things done, and it saves them a round trip, and it speeds up their process of diagnosis by at least 6 weeks. So it's wonderful, really. No downside.
Okay. Something I do want to touch on before we go, because we are coming up on 35 minutes. Many coming out of the lockdown, they're itching to go see family or travel, including myself. I've been wanting to go back to New York to see my parents. American Airlines has drawn criticism from a passenger who said she never felt so unsafe on board a flight from Fresno to Dallas. This happened on May 17th. Here's the video. Take a look.
So overcrowded.
So short clip there, but we can see that it looks packed, and this was on May 17th. So Krispin, will there be a safe way to travel in an airplane in a pre-vaccine era? And what kind of precautions will be needed to keep everybody safe as much as possible?
Yes, there will. Look, I can understand why people would be very worried about this, but it is interesting to say that really with some exceptions, there hasn't been widespread evidence of transmission of coronavirus in flights. It hasn't. It's a partial part of the problem. I think there are some reasons why that is. The laminar airflow in planes through HEPA filters means that you're not breathing everyone's air right across the plane. The fact that everyone's facing in the same direction, they're not talking and spitting potentially into each other's faces. Most flights are pretty short as well. So I think with all of these things, with returning back to work, returning back to business, we've got to not look at the even the economics or the passion and emotion. It's got to look at the science and see where transmission is happening. We have incredibly large amounts of information on where transmission is occurring. And I have to say, really, airlines have not been a prominent feature. I know that there are some exceptions, but really they're not accounting for the vast majority of transmission. That's at home, in people's homes. It's in close, cramped environments, sometimes with the service of alcohol, at a face-to-face conversation for hours on end. And that's where the money is. With airline travel, I think there are things that we need to learn and things that we can do to make it even safer. That'd be a lot of things around cleaning, hygiene, how the planes are loaded and unloaded, and how people interact with before and after the flight. And then whether there need to be considerations for long flights. So maybe if you're flying from Tokyo to New York, the risk is quite a bit bigger than if I'm flying from Brisbane to Sydney, and building that sort of concept into it as well, that the duration of the flight might be quite relevant as well. But I'd be hopeful that you can visit your parents prior to a vaccine being developed. I think that's realistic, and this fantastic idea of travel bubbles, of people travelling from low prevalence countries to low prevalence countries in a bubble, is a really good one, and I think has a lot of sense to it.
On average, trip lengths have fallen by 8.5%. So the average length in kilometres that people fly has gone down 8.5%. So the flying public are gradually returning, but there's a big drop in how far they're flying.
Krispin, I just wanted to ask you a little bit more about vaccines. Clearly, they're being accelerated in their development. What do you think the best outcome would be in terms of the durability of any immune response to a vaccine? Are we likely to need to have a booster shot at least once a year? How do you see that playing out?
Well, I think that's a really good question, Jason. And I guess so. There was a survey of infectious diseases specialists in Australia last week about people's prospects with the vaccine, and we got about one third of people thought one dose for a lifetime would be enough. 1/3 thought that you'd have to have a yearly dose, and 1/3 thought the vaccine wouldn't work. So it was pretty hard to draw any conclusions. But I'm bullish about a vaccine. I think the progress that's being made by universities and organisations around the world in vaccine development is really exciting. And there are over 100 vaccines in development, 176 at last count, I believe, using a variety of different strategies. So it's really clever. It's not just one strategy for all 176 vaccines. There are whole cell inactivated vaccines. There are attenuated vaccines. There are these subunit vaccines, and the really exciting adenovirus vectored RNA vaccines, which are very easy to mass produce. And the prospects are looking great, I have to say. Organisations like the University of Queensland and Professor Paul Young, who have a strong candidate vaccine well into production now, there are strong preclinical evidence of strong immune responses. In fact, the antibody responses, the neutralising antibody responses with the vaccines are way stronger than actual infection, which is really promising. There are now successful animal challenge studies. You vaccinate rhesus monkeys and ferrets and then expose them to coronavirus. They do not become sick with it. And now thousands of humans have received vaccines in trials in several countries now. We don't know if they work just yet, but there certainly hasn't been like a disastrous adverse effect or some problem with it, accentuation of viral infection because of the vaccine. It hasn't been blown out of the water. And I think it's really promising, therefore, that this is going to be a vaccine preventable disease within a year or so. You've probably also seen that in Australia and the UK and the States and elsewhere, there's this great idea of ramping up vaccine production now. And Stefan and the CSIRO are really a big part of that. But by the time the clinical trials are finished, maybe in September, there'll already be hundreds of thousands of doses ready to go as well, which is great. So I think it's really likely that we'll have a vaccine for this, and that we'll be seeing that roll out at the end of this year.
To what extent do you think that is going to be crucial for resuming international travel, for example?
I mean, it'll be the icing on the cake. I don't think a vaccine is going to be a solution just by itself for a variety of reasons. One will be how equitably that can be distributed through the world, but it needs to be done based on people's need and risk, not based on their ability to pay for it. It depends on how good the vaccine is, like you alluded to, will one dose be enough? Will you need booster doses? Will there be lifelong immunity or not? That's really relevant. But it'll be part of it. It'll be an important part of it, but it won't be the total solution.
All right, we got some great answers. Now we're going to take some questions from our audience. Here is the first one. How many deaths are actually from the virus? I think we're intentionally being misled. So some question on the data and whether the numbers are accurate and true.
I can take that one if you like. And I guess in Australia, we're in a very fortunate position of tragically having 102 deaths from coronavirus, but as a result, the data is very strong in Australia, and we're very confident that we're recording almost all of the deaths. In most countries, particularly those that are overwhelmed, there is no possibility that there's an accurate count, unfortunately. It really relies on a positive swab, a positive test, and in many countries in the world, the testing is just not available in the way it is in Australia. I think the best thing to look at is excess mortality, and I'm sure you've seen studies from Europe, USA, from Asia, many countries showing a huge increase in mortality, not necessarily attributed to coronavirus infections. The thing I think you've got to look out for in country data is if there's a very close proximity between the number of tested positive and the number of deaths, you've got to suspect that there's going to be a huge unrecognised problem in that country. So there are countries, I think, where I won't name the country, but there is one country where there have been 16,000 cases and something like 2,000 or 3,000 deaths. And it clearly shows that they're just not testing enough, and that will be a gross underestimate. In Ebola, in Africa, in H1N1 we didn't really find out the true mortality for several years afterwards, and it was based on excess mortality, and it will be way higher than 380,000. It will be way higher than the numbers now, sadly. There's also the second wave of death and illness caused by people's inability to access care. And I think, Stefan, you've also mentioned the wave of human misery that's going to be precipitated by the recession and the economic aspect of this.
Yeah, I mean, unemployment has been studied by epidemiologists as well, and it has a higher death rate. So long-term unemployment is about 1.3 times the standard mortality rate compared to not being long-term unemployed. So I guess if that is connected to it, then that is part of it as well. Cause and effect can be debated, but we shouldn't underestimate the human health, psychological and physical, of unemployment. It's terrible.
Okay, yeah. We have another question here. Let's go on to the next one. How can we really enjoy life in the new normal? Happy hour on Zoom is not so great. Ditto for concerts and Fortnite. So I guess this is talking about, maybe, Stefan, you can talk to this a little bit. This is a little
It's an interesting one. I mean, one thing we didn't mention in the conversation is some of the amazingly beautiful things that have happened in this world during COVID-19, one of which is a 17% decrease in greenhouse gas emissions. That was reported in a Nature paper since we last spoke, Kurumi. And I think is just in a world where we've seen greenhouse gas emissions going up and up, it's dropped for the first time. Decreased traffic accidents. In Australia, we've seen in April 25% reduction in road mortality. UC Davis, California study looks at a 50% decrease in fatal and injury crash rates on their highways. Some really good stuff has been going on during the COVID lockdown. As the question is more about as we go beyond and into this new normal and how can life be any fun, there are ways we can find it. I mean, I think let's look at a lot of ways people's lives have been enriched during this time. They say in Venice, they can see the fish in the water. In India, they can see the Himalayas. In Brisbane, from Mount Cootha, I can see out to the airport in Moreton Island at Stradbroke because the air quality is getting better. Some things are getting better, and I suspect aspects of people's relationships are better. A hell of a lot of mums and dads are out on the trails at Mount Cootha and on the bikeways with their kids, enjoying each other's time. I think we will find a way, and we need to get all the balancing done correctly. We can't have no human contact. We've still got to live life and have fun. But we try and, as Krispin says, let's look at the science and where we're taking huge risks. And I think the pandemic has shown us where there are huge risks, which may not be all that fun as well, which we can avoid. And then let's put the weight where things are good. But let's also look at the really beautiful things that have happened to humanity during the last few months amongst all the suffering as well. We've learned about what's possible. It'd be a tragedy to lose it.
Yeah, as brothers, Stefan and I have been able to connect really well in the last few months. You know, there are, as you know, the restrictions.
So is that an upside or a downside?
We'll get back to that later. But I mean, I think the opportunity I've had to connect with family, to spend time with my boys riding a biker in the local park is lovely. The restrictions in Queensland are easing up this week, and there's a part of me that's a bit worried about it, actually. The weekend suddenly seems to be much more full of social activities, and I'm going to miss aspects of this. Obviously, there are things I don't miss at all, but there are things I'm going to miss. We've discovered what a beautiful region we live in right around here. You know, all the great things you can do within a 50 or 100 kilometre drive from your house is actually fantastic. And I've met neighbours and people that I wouldn't have connected with. So there is a upside to it.
I haven't got on a plane for work since the 1st of January. So that to me has just been beautiful.
Just go with the science, though. We can do the fun stuff that's safe. We just have to restrict the stuff that's really dangerous. There's a lot of evidence now that really outdoor settings seem to be way safer, way safer. There's much more opportunity for social distancing. There's much more air clearance. UV light is a really effective antiviral, and there's very little evidence of transmission in outdoor areas. So let's see, go with the science, and if we can continue to confirm low transmission outdoors, let's do more al fresco dining, have things outside, have memorial masses and funerals in nature. That's what we've got to learn, and there's a whole lot of good stuff that we can take.
Yeah, instead of sitting in giant plastic wine glasses, those two people could be out on, in a vineyard in the field, having a glass of wine. There are. I mean, I'm not saying that's a bad thing that they're doing, but there are different ways. I don't know about the way they're drinking beer at that pub. That would just seem to. I'd find it fun for about 15 minutes, but that wouldn't work for me really.
Okay, so maybe more hiking and camping this summer, huh?
Yeah, I think so.
Okay, well, I think that was a great way to end. So that wraps things up for us here. Thank you so much to our special guests, brothers, the Hajkowicz brothers, Stefan from CSIRO Data61 Insights and Krispin from Australia's largest hospital.